on Bronx Talk AM, and our friend Jane Floro is here. And good morning, Jane. How are you?
Good morning, Gary.
Now, we are going to extend the boundaries of the women's segment. It'll be women and men because it really applies to everybody. Our good friend Dr. Lewis Rose is here. Jane, take it away.
Okay, yes, this is Dr. Lewis Rose. He's an orthopedic surgeon with Dogs Neck Multicare. And Gary and Dr. Rose, you both know, you turn on the TV every night and there's another reality show about some woman getting, cosmetically enhanced or changed some way, multiple surgeries to look a certain way. But some of us, believe it or not, what a concept, want to actually do it the old-fashioned way with, eating healthy, get in shape with exercise and healthy eating. And the component that I'm going to talk with you this morning is the exercise and physical activity component. So let's talk about some of the different forms of activity and exercise that people may be getting into now that it's the spring and they want to look good in their, jockey bathing suits and everything like that. So let's first talk about what you should do before you even begin any kind of physical activity.
One of the common things that people overlook, and it depending upon your age, but clearly patients over the age of 40 should see their physician and have an annual physical as part of their routine for getting ready to begin an exercise program. There are certain things that can creep up on you, especially as patients begin to get a little bit older, such as high blood pressure or diabetes or problems that you didn't even know you had that should really be addressed prior to beginning an exercise program. And your physician can obviously guide you as to what is best for patients who have high blood pressure and how to control that prior to beginning exercise.
Because it could be dangerous.
Yes, it can be dangerous. You can dramatically increase your blood pressure, and if you already have hypertension, high blood pressure, that can cause stroke or heart attack or problems that are totally avoidable. And the benefit of exercise, especially cardiovascular exercise, is that it tends to lower our blood pressure. And in diabetic patients, it also lowers the necessity for the degree of medicine that they have to use. So the first thing is to obviously make sure that you're medically in good health prior to beginning an exercise program. The next thing is to kind of, before we start working on our body, is to adjust our mind a little bit about exercise. Many of us have the conception that we're 18 and we've never changed from being 18. You don't do anything for 6 months. It's been a long winter, and all of a sudden you remember that you used to be able to run 3 miles in under 20 minutes. And patients go out and they start exercising, and what it leads to really is injuries that hamper their ability to continue an exercise program.
It's funny that you mentioned running because my friend is an avid runner, and lately she's been complaining about lower back pain, which could be a multitude of reasons that you would have it. But before you begin something like running, even if you used to run a few years ago or you never ran at all, obviously you want to get into the right kind of stretching and sneakers and everything like that. So. Well, if you feel that you want to be a runner, what should you take into consideration prior to doing something like that?
First thing you have to do is there are many things you have to do, but one of the things you have to do is be honest with the assessment of where you are in terms of your fitness shape. If you haven't worked out for a long period of time, you may want to begin with a simple walking program first. If you've gained a significant amount of weight, you have to take that into consideration in terms of your exercise program. You don't want to go out, let's say, and all of a sudden start running on muscles that haven't been stretched, muscles that haven't been accustomed to the activity, because all of our muscles have what we call muscle memory, and they will remember that at one time you were able to do this, but they're not conditioned to necessarily go beyond a certain point at the beginning of a program. So that you want to start by walking. You may want to start on a treadmill, which is a very forgiving surface first, prior to going outside.
Because that could be very damaging on parts of the body.
It's a big impact activity,
when you're running and your back and the bones and the knees.
Common things I see around this time of the year are patients who injure their ankles, their knees. They have the onset of back pain associated with overactivity in too short a period of time. You really need to pace yourself. And what I try to use as a rule of thumb, if patients haven't done anything, just go out and have a brisk walk for 20 to 30 minutes for 3 to 4 days a week. And then as you feel more comfortable with that, then you can pick up the pace of your walk, and then gradually you get into a light jog, and then you can take it from there. You know, one of the things, that it may sound obvious, but patients oftentimes too don't pick the right places to exercise. You know, and I thought about that coming here this morning as I drove by the track. You know, if you're on a track, first of all, you don't have to worry about cars. You don't have to worry about inhaling the pollution from cars, which has an effect on our body's physical ability.
And having one run into you physically.
Or having one run into you.
That could be pretty damaging.
Which is not good. And the other thing is that, you know, it's a more forgiving surface. It's easier to keep track of your progress because you're on a track, or if you have a path that you know the specific distance of. When we talk about being prepared to begin that as well, you want to have appropriate shoe wear. You want to have, as you said, it's an impact activity. Even as you begin walking, it's an impact activity. So you want to have appropriate shoe wear. You don't want to go out there and just, you know, any old shoe and start walking.
So what would be the appropriate shoe wear?
If you're going to be, let's say if you're going to limit yourself to brisk walking, they have excellent walking shoes that are designed specifically for walking. Yep, they're designed for people who are going to be walking. Obviously, any running shoe will give a person adequate support as well. You want to. It doesn't have to be the highest priced shoe, but you want to stay kind of in the mid range because there are components of sneakers and athletic shoe wear that really have protection to you. For instance, a gel heel cup imparts a lot of the impact and disperses it so that your heel doesn't feel it. You know, because what we're looking to do is to safely advance our exercise program with minimizing our injuries and not having a lot of injuries.
And you're going to want to renew them if you've had them for several seasons, right? Or get rid of them every year. What's the rule of thumb? Get rid of them every year?
I think, you know, depending upon your activity level, clearly, if you haven't worked out in a while, those shoes that you wore all last year are not going to give you the support that you need this year. So at least once a year. And if you look at real avid runners, they go through many pairs of shoes over the course of a year. You know, people who are committed to running throughout the seasons. You know.
So the key to running is to have the proper equipment, to start off slowly. The old saying goes, you got to crawl before you can run.
Absolutely.
Or walk, let alone
Absolutely.
run. So how about these people that run out and they see one of those infomercials on TV for Pilates or something like that, and they got those big giant balls, and
right.
I know if I got on one of those things, I would fall off and break my neck trying to do something. So what is your opinion of some of these tapes that are out that people might go and buy and bring them home, and next thing you know, is that the right thing to do?
You see, the thought or the way that they capture us in those infomercials is the fact that they make it seem as though it's effortless. You could do it at home, and it's a shortcut to getting somewhere.
Mm-hmm. They have a sweatless, beautiful model,
right,
and already in perfect shape.
That's right. And you know, the realities are that there are no shortcuts to getting there. The realities are that and you don't need any fancy equipment. What you really need to do is to have a consistent plan that you're going to follow and plot your progress. And as I said, it can start as simply as walking. You can get some simple hand weights, especially for women. You know, you don't need...
I did want to get into weights because...
Yeah, you don't need a very sophisticated weight system. You can have a 1 pound, 2 pound, 3 pound, 5 pound, and maybe a 7 pound dumbbell set.
Because they are saying today that women after the age of 30s start to lose muscle mass.
That's correct.
And if you build your muscle mass, you may be able to fend off the onset of osteoporosis if you might be prone to it. So it's no longer considered that male-dominated, you know, macho weightlifting. We're not talking about bulking up. So some people might get confused and they think that weightlifting isn't a thing to do. So you're talking about a different type of weights.
Weightlifting is an excellent activity. First of all, as you mentioned, for our skeletal system, weightlifting helps to have our bone retain the calcium that is required. Our bone responds to stress. So that as you put forces across it, like in your upper body, let's say doing various weightlifting activities, it causes your bone to actually become stronger and retain its calcium mass instead of losing. That's very important in women.
Can you actually reverse damage if you get into weightlifting, or just you stop and
what you do is you help stop in conjunction with calcium, appropriate calcium supplementation and eating appropriately. You help to stop further loss. Essentially, our body has all of the calcium it will ever have by the time we're in our late teens. So that when we take calcium supplementation and we work out with resistance exercises, what it does is it helps to dramatically decrease what we would lose. And that becomes even more important as women approach menopause, because once you're postmenopausal, especially now with the big issues, physicians were prescribing estrogens. Estrogens now have been linked to various forms of cancer, specifically endometrial cancer, which is obviously not something that anyone wants to take the risk of. So we know that calcium supplementation, resistance exercise, helps to maintain our bone mass. Interestingly enough, there have been many studies to also show for patients who want to lose weight and kind of get back into shape, aside from toning your muscles, the resistant component and the afterburn and the metabolic rate that is increased is actually increased longer than in straight cardiovascular exercise. So that patients who lift weights actually burn calories for a longer period of time than just someone who's out jogging or running for a half an hour.
And is it true that someone with more muscle mass burns more calories per minute than someone with less? And so it's a win-win situation with the more muscle mass.
It's a win all the way around. Clearly, muscle uses more calories than fat does to maintain itself. So you'll see a person who's relatively muscular can eat a lot more food without gaining any additional fat because his muscle burns it up.
And so what type of, you started getting into the weights. How should you use these weights?
Weight training exercises should be done in a same thing, in an advancing way. If you have never lifted weights, then I think it's a good idea to speak to someone who may be able to give you a little coaching, a trainer if you belong to a gym. If not, there are many books that you can get just in a library that'll give you a good insight into basic weightlifting.
But it's good to have somebody there with you who could visually see what you're doing and give you some recommendation. Well, even if you just do it, take one or two instructions, personal trainer or something like that. Wouldn't that be a good thing?
I think that's very beneficial because people they tend to think that it's about how much weight I'm lifting, especially in men. It's always been, a big macho thing, how much weight can I lift? And that's not really what it's all about. Your form is just as important as the weight that you're lifting.
And sometimes just the slight angle, which you would know as well as anybody, the slight angle of the way you do something instead of like this, maybe it's like this, and that could mean a whole world of difference to the benefit and also to the potential harm that you could do to a ligament or something else.
That's why good form is one of the most important things to have when we begin weightlifting. For women, you're not looking for the most part to bulk your arms or your shoulders or your back or your chest up. What you're looking to do is tone your muscles well. One of the things that people especially as women get older, they'll always say, "Well, I have this thing that hangs off the back of my arm." Well, you know what? You can tone that up.
Put your arms down.
Those tricep muscles can be toned.
Oh, okay.
I was showing the exercise, right?
Oh, there you go.
With the weight behind your back.
They can be toned up. All your muscles can be toned up, and to do that, you really need light weights. Begin at a range between 8 and 12 repetitions, and that's called a set. And try to do 3 sets of each exercise, and it could be as simple as doing some biceps curls, learning some of the basic triceps extension work, and working your shoulders and looking for some symmetry. And it doesn't have to be heavy weight to get a good.
Nice you could get in a good aerobic exercise and do something for your muscles if you 1 or 2 pounds. I think
that's exactly right.
Yeah. And these are the little hand things you get for $4.99 at Modell's.
Exactly, and not only can you get a good resistance workout, but if you set up your plan such that, let's say you work in your biceps, then you work your triceps, you work your chest, you work your shoulders, and you go from one exercise, each set, from set to set to set, you actually get an aerobic component to the workout as well. Mm-hmm. And that's why, the metabolic rate stays high.
How much time a day should you dedicate to make it worthwhile? For middle-aged people like my friend Jane right here.
I think that when you first start out, okay, if you're looking at the cardiovascular side of it, you want to start out and work your way to 20 to 30 minutes 3 to 4 times a week. And there's that formula that we always talk about where how do I know if I'm really working at the right pace for me? The right pace is if you take 220 minus your age times 0.7.
Get up my calculator.
220 minus your age.
Right.
Times 0.7.
Hold on.
And that gives you what?
That gives you 70% of what should be your maximum heart rate.
220 minus my age.
There you go.
It takes me a few minutes. Times 0.7.
0.7. Right, so
Okay.
that'd be like 119.
Gotta get
Right.
the calculator out. While he's doing that,
That is. So when I come up with that number 119,
119.
what does that mean?
That's the heart rate that you want to try to maintain for good aerobic conditioning while you're performing.
And a
your
lot of the
exercise.
elliptical trainers and treadmills, they have these monitors, so that's how you judge what it should
Exactly
be
right.
monitored.
And it's a range. You know, most people would say between 0.7 and 0.8 is an excellent range. So that if you say you're between 119 or roughly 120 and 130, that's an excellent range. And you know that you're getting a good cardiac workout, which as we get older, that's probably the most important thing to maintaining good health is good heart health. You know?
but as you said, and let's underscore what you said in the beginning, that is to see your doctor before doing any of this,
Absolutely. Absolutely.
because you want to make sure that
everything works,
you're
yeah.
in the proper form.
Well,
I just
yeah, you
want
don't
to
wanna
touch
hurt
on
yourself.
briefly, because so many people are doing it, and that's bicycling and rollerblading.
Mm-hmm.
Some of the more obvious pieces of equipment that you should use, and maybe some of the hidden dangers. I know firsthand.
Yeah.
I have a permanently damaged
Oh,
ligament
right, you've
in my
got it,
left
yeah.
hand
Yeah.
from getting on those rollerblades for some, because I had some kid sell some. He goes, "Oh, these are better. They're on sale." But I didn't know that I had a very advanced heavy pair
Right.
on me for the first time, and my voice in my head that I should listen to, which everyone should listen to,
To the
is
little man.
that little voice in your head, and that is when I first stood up in them and I moved around. I thought to myself, "They weigh a ton."
Yeah.
I feel like
very
I
heavy.
have giant 50-pound
like
weights
ankle
on
weights.
both my ankles.
So what kinds of things should you look for?
As far as the rollerblades go, obviously they're made from the beginner stages up to people who are very advanced. I think that somewhere in the middle is like an okay place to be. You want a pair that feels comfortable, obviously provides adequate support. It may not be the cheapest pair, but it doesn't have to be the most expensive pair. I think when we're talking about rollerblading, even more important than the blade itself is, and I mean, it was an ingenious marketing tool if you think about it. They came up with all this other additional protective gear that people look like RoboCops when, you know, if they're appropriately protected. But you need elbow pads, you need knee pads,
helmet.
a helmet.
A helmet by
You gotta
law.
have a helmet,
Yeah.
okay? And, you know, then they make all types of other padded clothing similar to like what bikers wear with padded seat and so forth. But
I
not to
wouldn't do it again with a Michelin Man suit on, okay? There's just no way you're going to get me out there again like that. I just learned a very valuable
and
lesson.
obviously a safe place. Because, you know, if you're darting in and out of cars,
Yeah.
even whether you're on a bike or on rollerblades,
And especially
you're gonna get hurt.
a safe place to start. I mean, when you get
Absolutely.
started, you want to make sure that you can really do it in a
Absolutely,
park
you
or
do.
something
And
like
the
that.
key is to be careful in everything that you do, because a cast isn't a very attractive accessory
No.
to your bathing suit.
Although it's good
You
for
know,
weights.
you know,
It's good for weights.
you know, you got your new bathing suit on and a full body cast. It's just not attractive.
You know, I think in summation, what I would say is that also you need to remember that you can make up for a year's worth of neglect in 1 month. And that goes for both weight control as well as fitness. You need to take a plan, make up a plan that's a reasonable time frame. If you haven't done anything for 6 months or a year and you want to try to get back into shape, understand that you'll make significant strides in the first 6 to 12 weeks. But it's not going to happen in 2 weeks. So, you know, if you're trying to get ready for Memorial Day, it's not going to work.
Not now, anyway. Yeah.
Not now.
Dr. Rose, sound advice and the kind of thing that I think a lot of us, again, I don't want to beat a dead horse, but us middle-aged folks are thinking about it. That gee whiz, you know, we want to make sure we stay in shape and all that, and we
Absolutely.
really appreciate your.
And
your
if for
input.
some unfortunate reason that someone should injure themselves,
gotta call you.
and they need appropriate care,
Right.
where could they find you, and how could they call you?
My office address is 3058 East Tremont Avenue, right here in the Bronx. Our telephone number is 718-409-0500.
Okay,
Can we get that in? 409-0500, please?
Dr. Rose, thank you so much.
Always a
It's
pleasure.
great to have you here, and you know, just reminding us of things probably a lot of people know, but they tend to
You
forget.
tend to forget it.
Jane, thank you.
Thank you. You know, it makes so much sense because, you know, you can't, you know, most people can't go out and work for 3 weeks and make enough money for the whole year.
That's right.
So you can't go out and work out for 3 weeks and get your body in shape for the whole year.
Exactly right. Exactly right. Little steps lead to big steps.
And then one day you can look like me. We'll he laughed. That's nice. I appreciate that. We'll take a short break. We'll be right back.